But COVID is not entirely gone just yet. Here in Lubbock, we're seeing a slight uptick in cases, averaging about 70 new ones a day. But in a lab over at the Texas Tech Health Sciences Center, doctors and researchers are working around the clock to understand which strains of the virus are spreading here on the South Plains. And what they find out here in the 806 can actually help doctors in other parts of the U.S. KLBK's Elizabeth Fitz explains.
Here at the gene sequencing lab in the Department of Immunology, these scientists are working to get these positive COVID tests ready for further testing. They are trying to identify what strains are here in town. And interestingly, as of May, they've identified a possible new variant that has been seen across our state but not yet named. Since the start of the pandemic, Texas Tech Health Sciences Center has been using its gene sequencing lab to monitor coronavirus cases in the region.
They are serving more than 67 counties in North Panhandle and West Texas. They also include some of the counties in the southeast New Mexico and south of Oklahoma.
Knowing the kinds of viruses in the community prepares public health officials on how to respond. But the process of identifying mutations can take several days.
When the virus mutates, the biotechnology companies, they have to create the tools so that we can use here and we can identify that virus there.
And then the lab can identify how prevalent that variant is in our region. But that's not the only benefit.
Once we have the gene sequencing done, then the pharmaceutical companies that make vaccines can make those vaccines very easily.
So the information found in this Lubbock lab can put communities across the country ahead of the curve by sharing data with experts who need it to fight this ongoing battle.
So everyone needs to work together as we define what corona strains are in the community.
The lab is asking anyone who tests positive using an at-home test to go to your doctor or our local health department to get a PCR test so that this lab can better understand what variants are floating around our community. Reporting from the Health Sciences Center, Elizabeth Fitz, KLBK News.